Good evening, everyone. We are going to go ahead and get started. First of all, I would like to thank you for joining us this evening. My name is Crystal Barter, and I am the Director of Programs and Services at the Michigan Center for Rural Health. The MCRH is a nonprofit state office of rural health, and one of our many resources is offering educational programming to providers working in rural Michigan. Today, I would like to welcome everyone to our Pediatric Grand Round series. This evening, we will be discussing marijuana use in teens, shifting through the weeds. This program is jointly provided by the Michigan Center for Rural Health, the MSU College of Human Medicine, the MSU College of Nursing, and the Michigan Social Work Collaborative. Before we begin the program, just a couple of reminders. Housekeeping. Handouts are located on our website at mcrh.msu.edu. Please click on the education link at the top and scroll down to find today's date, and you will see the presentation, and I will email out the evaluation link. Continuing education is available for physicians, nurses, and social workers for this evening's presentation. Your evaluation will be emailed directly to you following the program. If you are attending in a group format, please email me a list of everyone, first and last name, and an email associated with them that attended at your site. This way I can email them the appropriate documentation. The evaluation must be completed online and needs to be completed in order to obtain your CEUs. Please complete the forms within 2 weeks or by April 6th. Thank you. With that, if you would like to ask a question during the program, please type it into the chat box and we'll facilitate a question and answer session at the end of the presentation today. Our speaker indicates no conflict of interest, and the planning committee did not have any conflicts. There is no commercial support for this program. With that, I'm very pleased to introduce our speaker. Dr. Anju Sawhney is a pediatrician and director of adolescent medicine at Hurley's Children's Hospital, Hurley Medical Center in Flint, Michigan. She's also an associate professor of pediatrics at the Department of Pediatrics and Human Development. Just a reminder, if you just joined the call, please mute your microphone. Thank you very much. Thank you. Dr. Sawhney completed her pediatric residency from the Children's Hospital of Michigan at Wayne State University School of Medicine, and then went on to do an adolescent medicine fellowship at Cornell University. After completing her fellowship in adolescent medicine, she joined the Division of Adolescent Medicine at Children's Hospital of Michigan, where she was assistant professor of pediatrics until 2012. In 2012, she became the director of adolescent medicine at Hurley. She is very passionate about providing the best medical care to adolescents, especially in regards to high-risk behaviors such as teen pregnancy, STI, substance use, school problems, and violence. Her interest not only includes adolescent health, but also integrative medicine and mindfulness in medicine. She is a member of the AAP section on integrative pediatrics. She's done research, published several papers, and written chapters on adolescent health and integrative medicine, as well as presented many lectures, workshops, internationally, nationally, statewide, and locally. We're very lucky to have her presenting virtually with us this evening. She's also very actively involved in both the medical student and resident teaching at MSU CHM. So with that, I will turn it over to our expert for the evening. And thank you for sharing your expertise, Dr. Sawhney. Appreciate it.
Good evening, everybody. Thank you so much, Crystal, for that very kind introduction. And indeed, it's my pleasure to be here tonight to be a speaker for the Michigan Center for Rural Health Grand Rounds virtual series. I appreciate everybody being here this evening, because my understanding is generally the Grand Rounds are in the afternoon. But I'm appreciative of a bit of a change in the schedule, because I certainly know that everybody's got lots of family obligations in the evening. So I truly appreciate your time to be here today. So the talk is on substance use in teens, and particularly my focus is going to be on marijuana use. This is a huge topic. I'm really going to try and sort of literally touch the tip of the iceberg in 1 hour. By no means am I an expert in this area at all. And really what I hope to do is just share some of the information that I know about substance use in teens and marijuana use, and then hopefully we'll have some time at the end to answer some questions. I tend to have too much information and talk a lot, so I'm going to talk fast. But in general, we know that substance use is really a complex phenomena, and increasing information that addiction is really a central nervous system disease with specific structural and functional changes that happen within the brain that are genetically determined as well as environmentally, particularly among adolescents when the brain is still developing. So as we said, adolescent is really a period of experimentation and, high risk behavior and engaging in experimentation with sexuality, drug use, peer pressure, all those play a role during the adolescent period. And that it's sort of normative behavior to maybe experiment with different substances, not every adolescent, but certainly among many. And our job really as healthcare providers is to try and identify the teens that are just experimenting, smoking weed, experimenting with alcohol versus the adolescents who are going down the road of true substance abuse. We also know that most adolescents who use substances sort of use co-substances. So if they start off with vaping, cigarettes, and nicotine, then more likely that's the same teen who's going to go on and drink alcohol, and the same teen who's going to then go on and experiment with marijuana and other drugs. And if adolescents start with substance use, if teens start using substances during the adolescent period, generally those teens are going to have a higher prediction of addiction and problems. And we'll talk a little bit about sort of how substances affect the adolescent brain a little bit further down in our talk. And definitely when we're going down the road, when the teens are going down the road of substance abuse, that can impact their daily life, impact their academic achievement, and overall have a negative effect on their life. The most common substances used among adolescents and really even among adults is alcohol is still the most common sort of illegal substance among adolescents because of the age. And marijuana is also considered one of the most illegal drugs used among adolescents. As marijuana has become legalized and as we are studying more about marijuana and its effect on the developing brain, we are seeing that marijuana has been linked with episodes of increase in mental health illnesses among adolescents, increases in psychosis, anxiety, panic attacks. And that is definitely very worrisome. So a little bit about where do we get our data and information in terms of the trends of substance use among teens. And one of the sources is there's an annual survey that is conducted through University of Michigan called Monitoring the Future Survey. And this is an annual service in connection with the University of Michigan and the Center for Drug Use, NIH. And they give this survey annually to 8th, 10th, and 12th grader. It's an anonymous survey. They survey over 30 to 40,000 adolescents across all different middle school and high school areas, across all rural, urban, suburban schools. And they conduct this survey every year. And that's kind of where we have our current data and trends in terms of substance use among teens. So currently, the most current information, and hopefully you can see my slide, but I really want to kind of point out, let me just sort of move this down a little bit, but I want to point out that in general, data from the Monitoring the Future survey showed that there was an overall increase in substance use among 8th graders, 10th graders, and 12th graders in 2018 and then 2019, as you can see, increase in drug use. But in 2020, maybe substance use stayed about the same, and that's when the pandemic hit, so we're not really quite sure about the data in 2020. But the good news is the most recent Monitoring the Survey data came in 2021 and shows a significant decline in overall substance use in teens among all grades, from 15% to 10% among the 8th graders, from 31% to 19% among 10th graders, and then 38 to 32% among 12th graders. So that's really encouraging news that despite the pandemic, despite all of the stressors in life, overall substance use among teens is declining. And really for us in adolescent health, that's really quite encouraging. This slide really, again, shows us what are the trends of US students reporting any past year illicit drug use? So that includes alcohol, it includes marijuana use. And again, as we can see, sort of a steady use of all kinds of substances in 2015, 2017, 2019, and then quite starting to show a decline and a huge drop in use of all illicit substances again in 2020, about a 5% drop among 12th graders, which is the blue line, and almost a 12% drop in any substance use among 10th graders, and a 5.4% drop among 8th graders. So again, really good news. That drug use is at its lowest since the survey started, which is in 1975 among adolescents. And so that's encouraging. Now, we go back and think, well, 2020 and 2021 were pandemic years, and 2020 with lockdown. So, totally teens were not going to school. Access to drugs was not happening in 2020 because the whole world was literally in lockdown at that time and nobody was going to school. So we would expect a decline in drug use among teens because one of the sources of their substances and drug use is really from their friends or in school areas. So, not going to school would certainly impact the fact that they didn't have access to drugs. But the nice thing is that in 2021, when most of the teens were back in school, particularly high schools were pretty much back in person, and sports were starting, and teens were starting to engage with their friends and go out with their peers. It's nice to see that trend and drop of overall substance use continued and dropped dramatically in 2021. So, another factor that may be playing a role in decrease in substance use among teens in this pandemic world is that parents were home more with the teens. So there were more supervision, there was more family time, more interaction between parents and teens because many of the parents and teens were working from home. They were spending a lot more time. There's just overall a lot more family time or a lot more adult supervision time as well. And so I really consider that a silver lining of the pandemic for our adolescents, that they really connected with their family, and the families and their parents and significant adults in their life had a positive impact in their life, and therefore decreasing their risk for substance use. So those are some of the theories out there. But just in overall, we talked about the fact that alcohol and marijuana in particular, is still considered the most illicit drug among all ages, to be honest. So where are we in terms of trends with respect to alcohol use, and then cigarette use, and then marijuana use? So I'm going to just cover those three areas mostly. So in terms of alcohol use, as you could see from this graph, past year shows that there's a decrease in alcohol use again among adolescents, particularly in the past 5 years. From 2015 to current 2020 data, there is a downward slope. So, but alcohol is still the most common illicit substance used among adolescents. So 55% of 12th graders reported that they had used alcohol in the past year. 41% of the 10th graders, which is the red line, and 21% of the 8th graders reported that they'd used any alcohol over the past year. We know that most adolescents don't necessarily engage in daily drinking, but do more what we call binge drinking, particularly in the 11th and 12th grader, and particularly in college. So again, overall, about 17% of the adolescents reported that they were engaging in binge drinking of alcohol, about 10% of the 10th graders, and about 4.5% of the 8th graders reported binge drinking. Now, again, looking at the most current data, which is 2021, I just want to point out the red line is the 12th grader, and this is the dot for 2020, and this is the current 2021 data. So huge, steep decline in alcohol prevalence in the past 12 months among 12th graders, 10th graders, and 8th graders. So this nice steep decrease in use of alcohol. So a significant drop in alcohol use persisted in 2021, even when kids were starting to go back to school. Where are we in terms of cigarette use? And when I'm talking about cigarettes, I'm talking about classical cigarettes, tobacco. And overall, the past 20 years, there has been a decline in cigarette use among 10th graders, 12th graders, 8th, 10th, and 12th graders. So overall, there's been a huge decline in cigarette use. But again, as I want to point out, dramatically, even more of a decline from 2020 to 2021 in lifetime prevalence use of smoking cigarettes. But the flip side is that we're certainly seeing and have seen an increasing in what we call e-cigarette use and vaping among adolescents. So e-cigarette cartridges, and that's really a talk in its own, to be honest. So I'm not going to go into a whole lot of detail today, but e-cigarette cartridges contain nicotine. They contain flavorings, as they call it, which often are laced with nicotine, and many of the teens don't know that, or they could contain liquid form of marijuana. So teens are vaping flavorings, nicotine, marijuana, or all of the above, or mixed. Who knows what they're doing? Sometimes they don't even know what they're vaping, but vaping has certainly gone up. So as we can see from this data, huge increase in vaping among adolescents in 2018. 2019, we peaked in terms of adolescents engaging in e-cigarette and vaping. And then it kind of just leveled off in 2020. So between 2019 and 2020, about 35% of 12th graders said that they had vaped in the past year, and they said that was particularly nicotine. About 31% of the 10th graders said that they had vaped nicotine in the past year, and about 17% of the 8th graders had said that they vaped nicotine. Again, the current data in 2021 shows, again, another nice steep decline in even vaping among 12th graders. So down here among 10th graders, down here, and among the 8th graders. So despite the fact that we're seeing a rapid increase in vaping, there is now a downward trend from the 2020 monitoring the future data. So as we said, adolescents are vaping not only nicotine and flavorings, but also marijuana. So where are they and what are they reporting in terms of specific marijuana vaping? And again, past year marijuana vaping was reported to be about 22% by 12th graders, about 20% among 10th graders, and about 8% among 8th graders. Daily or almost daily vaping of marijuana has been on the decrease. So that's really encouraging among all grades, 8th, 10th, and 12th from 2019 to 2020. So the blues are the 2019 bars and the greens are the 2020 bars, indicating that there has been a decline in daily vaping of marijuana as well. So moving on to just overall use of marijuana in all forms, whether they're vaping it, whether they're smoking it, or whether they're eating it now. As we said, marijuana is the most common illicit substance, and it's remained, use of marijuana by adolescents has remained about steady over the past few years, particularly in the past 5 years, there's been steady use of marijuana. So again, about 36% of the 12th graders reported past marijuana use. 28% of the 10th graders and about 11% of the 8th graders. So it's sort of a steady bar, not very much decline in that. Daily marijuana is about 7% of the 12th graders reported daily marijuana use, 4% of the 10th graders, and about 1% of the 8th graders. But still good news on the marijuana side, even though there's been steady use and it's the most common illicit substance. Again, among 12th graders, significant decline from 2020 to 2021 in report of past 12-month use of marijuana. Same for the 10th graders, significant decline from 2020 to 2021, and same for the 8th graders. So that's also very encouraging. So overall, the good news is, despite what we're hearing in the media, the adolescents, and again, these are self-reports, so we do have to keep that in mind, but because they're anonymous surveys and the adolescents are used to doing them and they do them almost every year, we're hoping that the data is reflective of honest use by the teens. But overall, the trends show that there is a significant decline in all substances in adolescents, 8th, 10th, and 12th graders in particular, across all areas of substance use. So that is very encouraging and good news to hear. So on that note, I'm going to move on and talk specifically about marijuana, mostly because we're certainly seeing a steady increase in use of marijuana, and as well as the fact that legalization of recreational use of marijuana has certainly heightened our concern as pediatricians and physicians taking care, and healthcare providers taking care of teens, about the negative effects of legalization of marijuana and use of marijuana among adolescents. The good side, I'd like to say, of legalization of marijuana is that now we can actually get funding to study marijuana and its effect on the brain, because quote unquote, it is in most states, or more and more states, a legal substance, at least, legal medicinal use of marijuana is being legalized. So we're able to study it more and get actual funding, governmental funding, and to study marijuana. So I think that's really sort of a plus part of legalization, is allowing us to do more research on it. So all of us have heard about marijuana. There's a lot of different names about marijuana, and how we ask teens, what do they use? We can call it blunts, ganja, gangster, grass, weed, reefer. We're all familiar and heard lots of these words everywhere. They've been around forever. So sometimes when I'm asking my history and doing my substance use history with teens, I'll say, depending on what the lingo is in the area that I'm working, do you use weed? I don't really say marijuana. I usually say using weed or using pot, depending again on what the lingo is in that area, because it varies from community to community. But overall, what is marijuana? So it's really a complex plant species. So marijuana is the dried leaves and flowers of the cannabis species. And the cannabis species has many, many hundreds of subspecies in it. And in particular, the cannabis sativa and cannabis indica are plant species that have high concentration of THC in what we call the marijuana plant, in terms of how we're using that connotation for drug use. So there's more than 500 chemicals in the cannabis plant species. And the most active chemical that causes a high or causes a psychotropic effect is what's called the delta-9 tetrahydrocannabinol, or THC. So many of us have heard of the word THC, and delta-9 tetrahydrocannabinol is its chemical name. And that's the chemical that is found in marijuana that's responsible for the marijuana's drugs psychotropic properties and the kind of the mind-altering high that a person may experience when they're using this drug. So again, as we said, many, many different cannabis species. There are over 60 different what we call cannabinoids in these species. There's cannabinoids, there's cannabidiols, which is CBD, and then there's a delta-9 tetrahydrocannabinol, which is the THC. So, there's a lot of confusion with these terminologies, and lots of us have heard these words, especially CBD or cannabidiols, and then, the THC word. So it's a bit confusing, and we're still learning a lot about it. So I really want to show this study here because I thought this was very good, because basically this graph shows that the THC potency in the marijuana that is out there in the streets and being used is getting stronger. So this is a graph that shows the percentage of THC and CBD in cannabis samples that were seized by the DEA from 1995 to 2018. So the blue line here represents the potency of THC in the marijuana plants that were seized. And then the green line is the CBD. These are both cannabinoids found in the marijuana plant. The THC, of course, is the one that has the psychotropic negative effects in the brain and causes the high. The CBD is sort of the good part of the plant that has other positive properties to it. But as we could see, particularly more in the past 10 years, there's a trend towards increasing potencies of the THC in the cannabis plants out in the street. And this is really worrisome because in the early 1990s, the average marijuana weed or that was being sold on the street had THC content, which was less than 4%. Now, a lot of the marijuana that's being sold, legal or illegally, and certainly illegally, we don't have no idea how potent it is, has more than 15 to 20% of THC. So much higher concentrations of THC. Also, with all the sort of technology we have out there now, we are able to isolate and draw the pure THC oil out of the cannabis plant. So now we've got pure THC oil that is being sold out there, and kids are smoking that. So they're literally inhaling a very high potent part of amount of THC, and that can have significant negative effect on anybody's brain, but in particularly the adolescents whose brain is still developing. And I am definitely seeing a lot more mental health stuff, paranoia, anxiety, and other systemic symptoms as a result of smoking more potent weed. So we'll talk a little bit about that later on. I like this slide because, certainly in the USA with legalization, both of medical marijuana and recreational marijuana, there's been a shift in the cannabis landscape and also increasing social acceptance of marijuana use, very much like alcohol. The US map is becoming definitely more green. And so currently in the United States, this is a map of marijuana legality by state, and this is the current data as of June 2021. And if you look at this map, of course, on the east states and the west side, the two most sort of liberal states in California and New York, the dark green, marijuana has been legalized both for medicinal use as well as recreational use for many years in the east and west side of USA. The sort of next kind of a little bit lighter green area are these states here where marijuana is medically legalized, but it's also decriminalized. And again, then another area, a little bit lighter green, indicates these are the states where medical marijuana is legal. And then the lighter, a little bit lighter green is that marijuana has just been decriminalized. It's not legal. The gray states are the states where only CBD component of the marijuana or cannabis species is legal, not the species that has THC in it. And then the orange states are the states where marijuana is fully illegal. So again, we are becoming much greener in the USA upon legalization of marijuana, recreational and medicinal use. In Canada, our neighbor, I'm from Canada, marijuana has been both medically and recreationally legalized in 2017, and the whole country, it was sort of a federal rule passed that the whole country marijuana was legalized for recreational use, and unlike the United States where it's more regulated state by state. So therefore, the current legal status of marijuana use as of 2021 in the US is that 48 out of 50 states and District of Columbia have passed laws that permit use of marijuana for medical purposes. In Michigan, that happened in 2028, and in 2008. In 18 states, including Michigan, medical marijuana was fully legalized for both medicinal and recreational use. And in Michigan, marijuana was legalized in 2018 for recreational use. And then 31 out of the 50 states have undergone some sort of decriminalization of marijuana laws. And so, taking it out of the criminal justice system and putting it into the civil justice system. Nonetheless, marijuana possession, sale, and use is still considered illegal by the federal law, making its status quite ambiguous. And so under the federal law, marijuana continues to be prohibited, and it's considered as a Schedule I drug, which means that there's currently no accepted medical use of marijuana at the federal level. So, this is sort of a gray zone. But really, when you come down to it, state by state, marijuana laws are regulated individually. So therefore, in the state of Michigan, when recreational marijuana was legalized, what did that mean? And that happened, as you said, in December 6, 2018. And at that time, Michigan was the first Midwestern state to legalize adult use of recreation marijuana. So what that meant, or what that means even currently to date, is that recreational marijuana legalization means that adults 21 and above are permitted to possess and consume marijuana. They can consume and possess up to 2.5 ounces of marijuana and transport it at any time. So they can carry it on themselves, they can carry it in the car, and that's within the legal exceptions. And 2.5 is sort of a small sandwich bag full of marijuana flower and leaves. Up to 10 ounces can be kept at home, but only 2.5 ounces can be out at a time. The remaining 8 ounces has to be locked away. And then up to 12 marijuana plants can be grown by individuals in their own house. Beyond that, you need to then get proper licensing and proper regulatory control through the Michigan LARA licensing and regulatory agency to be able to grow more than 12 plants of marijuana. But if you can grow in your home for home use up to 12 plants of marijuana. So certainly what is not allowed is driving under the influence of marijuana. That's prohibited, very much like alcohol. So the driving laws are the same as the laws under alcohol use. Consumption of marijuana in public places is prohibited, very much like alcohol. And municipalities can ban retail stores or marijuana dispensaries if they want, but they can't ban consumption of marijuana by adults 21 and older. So that's certainly been Each municipality and different townships can decide whether they want a marijuana dispensary in their area or not. And they certainly can ban retail sales of marijuana and dispensaries, but not ban use of marijuana by adults to 21 and older. So with this sort of acceptance of legalization of marijuana, and as we go through election periods at each cycle, more and more states are legalizing recreational marijuana use. So, it's becoming socially acceptable. And that's kind of the message our teens are hearing out there. Is, oh, it's legal, Dr. Sonny. Oh, it's fine because it's legal. It must be okay because it's legal. Oh, everybody does it because it's legal, So that's kind of the message they're hearing. So what's their perception about marijuana? Well, their perception is that, and again, this would be adolescents and adults, is that there's been a decrease in perception of harm from smoking marijuana. And there's a decline in perception that marijuana is bad or that it offers a risk. As I said, among adolescents and adults, and particularly adolescents are influenced by what the adults are doing and saying. So if they're kind of hearing the adults say that, hey, weed is okay, hey, it's legal, it doesn't hurt you, you don't get addicted, all this kind of stuff out there, it's good for chronic pain, it helps with sleep, it helps with anxiety, which is what I hear all my adolescents tell me right now. Everybody's got severe anxiety and sleep disorder. Then they tell me, well, so I'm using it because everybody around me is using it. So my focus is to help them understand that it's still a drug, and my emphasis and my discussion with them is on that part and how it negatively impacts their brain. So, where's the AAP with all the legalization, and what's AAP's stand on marijuana? So AAP opposes legalization of marijuana because of the potential harm to children and adolescents. But AAP does advocate for decriminalization of marijuana, and decreasing penalties for use and possession of marijuana, and basically taking it out of the criminal justice system. In states where marijuana is sold legally, either for medicinal or recreational purposes, AAP advocates that strict regulation and penalties should be in place for those who are using it below the age of 21, or who are trying to sell it to children, or who are trying to bring it into our school, as with any other drugs, and that edible parts of marijuana should be really distributed in childproof packaging, very much like any other drug out there, to prevent ingestion by younger children. And of course, AAP discourages adults from using marijuana in the presence of children because of the influence of role modeling and influence of substance use on children by their parents. Again, no different than alcohol use, nicotine use, and all of that. Certainly, I don't know about you all, but we are definitely seeing a lot more emergency room visits in our pediatric EDs with young children who've ingested marijuana accidentally, or or toxicity from marijuana ingestion, particularly because the edibles are out there and they look like cookies and brownies and gummy bears, and that's how they're all marketed. So the kids think that it's candy and they eat it, and here we go, they're coming into the ED with marijuana ingestion and toxicity. So we're definitely seeing a lot more of that in the emergency room. We're definitely also, among our pregnant moms, seeing increase in marijuana use during pregnancy and persist during pregnancy, and therefore a lot more of babies born to moms who are using marijuana when they're pregnant. And we fully don't know the effect on the fetus of marijuana, but I suppose with our experience in drugs and alcohol and nicotine, we can presume that it's going to be a negative effect on the fetus. But that's to be determined. So, as we said, in the state of Michigan, which is the agency that regulates marijuana use at dispensaries, it's LARA, the Licensing, Tracking, and Regulatory Agency. And what its goal is to ensure that if you are planning on opening up a marijuana dispensary store and sell it, then you have all the proper rules and regulations in place. You're only selling it to 21 years and older. You're monitoring that strictly, just like alcohol. You're packaging it appropriately. So they place a lot of restrictions, and they monitor these dispensaries to make sure they're following the law. In marijuana, edibles, which is really sort of the new hot thing since it became legalized, are available in these dispensaries. And I don't know if any of you have been to any of the dispensaries in your area. I would encourage you, if you see adolescents and work with adolescents, particularly in terms of substance use disorder, encourage you to go to one of these marijuana dispensaries and vaping stores and kind of look at it for yourself. What's there and what do they look like and what are the kids buying and how are they being packaged? I've done that in many dispensaries across the country. In fact, when I go on vacation, that's what I do. I go to different marijuana dispensaries, kind of see what's happening out there. My kids are appalled with me. But as you could see in this slide here, these edible marijuana products look like candy. They look like cookies. They're brownies. They're, look like Rice Krispies, all yummy, yummy things that kids are going to eat. And definitely the younger kids are going to eat it and think it's candy, and unfortunately have toxicity. And even older adolescents, because it's yummy and tastes good, they just keep eating more and more of these edible marijuana, infused marijuana food, and they could definitely get a significant toxic effect as well. So, we've got to be really careful about marketing edible marijuana products. So now moving on to what are the negative effects of marijuana, particularly in the developing teen brain. The teen brain is sort of a confusion of lots of things and not always focused in areas that we would like them to be focused on as adults. But as development of MRI and brain scans, we've been able to really study and understand the brain development a lot more. And research has shown that brain development continues well into the second decade, into the early 20s. Before we used to think that brain development finished in adolescent because they were physically fully developed, the brain was also fully developed. Just because the legal age of adulthood is 18 does not mean that 18-year-olds are emotionally and cognitively mature. That maturation does not fully occur until the early 20s. And in particular, this slide sort of shows very nicely what's happening is the normal brain development process. So if we sort of start off with the brain development at an early age in 5 or 6, where there's less blue, the areas that are blue are the areas that we call the gray matter, where pruning is happening. And what that means is that there is more efficient neuronal connections happening in those parts of the brain. So as you could see, when we're younger, there's not a lot of blue areas. And as we progress into early adolescent and late adolescent and young adulthood, there's more increase in pruning and better neuronal connections and neuronal communication between different parts of the brain. And in particular, the last part of the brain to mature and develop the neuronal connections is what we call the prefrontal cortex, the frontal lobe. That's our executive part of our brain. It's our higher functioning part of our brain that helps us make decisions involved in decreasing impulsive actions, understanding the consequences of our behavior. So, it's our more mature part of the brain. And that's the last part of the brain that is developed. And studies are showing that that's the prefrontal cortex is the part of the brain that is negatively impacted by marijuana use. So, our executive functioning part of our brain, our part of our brain that helps us make good decisions and good judgment and planning, involved in problem solving, in executive function, this is the part of the brain that is potentially the most susceptible to marijuana use, particularly in the adolescent period when it's not fully developed. So in summary here, the slide again nicely summarizes what's happening in the adolescent brain, that it continues to develop in early adulthood, that there are additional connections and increase in what we call pruning and neuronal connections between the different parts of the nerves and the brain cells. And the prefrontal cortex and the amygdala are the last part of the brain to mature, and there's a lot of remodeling happening and development happening during the adolescent period. So it's a very vulnerable part of the brain during the adolescent period. And if you're introducing significant substances, particularly mind-altering substances, they can have a significant permanent long-term effect on the adolescent brain. So how does this is a busy slide. I apologize. I don't want you to learn everything that's on the slide, but it's kind of just a good graphic picture of the fact that what's happening in our brain and how does marijuana affect our brain. So our own body has a natural, what we call endocannabinoid system, and that's what this picture is. It's sort of a general picture of these endocannabinoid receptors called CB1 and CB2 normally in our body. And these receptors are activated by a chemical that our body produces naturally called anandamide. And the next slide, I'll show you anandamide structurally looks very similar to THC. So this endocannabinoid system that exists naturally in our body has these cannabinoid receptors, and CB1's receptors are predominantly found in the brain. So the brain has predominant CB1 receptors, and our gut has predominant CB2 receptors. So these are cannabinoid receptors. So here's a nice picture showing that the normal brain chemical here, anandamide, structurally looks quite similar to the psychoactive chemical THC found in marijuana. So the normal function of the anandamide structure in our body is the anandamide is a brain endocannabinoid. It attaches to the CBT receptors, and it's really involved in the brain, in brain growth, in regulation of other neurotransmitters, and in our overall executive functioning skills. But when you start using marijuana and start inhaling marijuana, then THC, which is a pretty potent and a very similar chemical to anandamide, it binds to the CBD receptors in the brain and displaces anandamide, and it causes a chemical reaction in our brain that is a negative chemical reaction, and therefore affects and influences normal brain development and normal brain neuronal connection. So that's kind of how, as we understand it to date, THC sort of mimics our own body natural anandamide and replaces it, and therefore has an overall negative effect on the developing brain. So on that note, what are the long-term effects of marijuana on the teen brain? So again, this is a slide that's got a lot of information, so I'm not going to go through it all, but overall, I just want to show this slide to say that all parts of the brain have the cannabinoid receptors, CB1 receptors. So therefore, when you're using marijuana, particularly if you're using it in a much more chronic basis, or high amounts of marijuana products that have high concentrations of THC, these brain CBD receptors get inundated with THC, and all parts of our brains are affected. So what does that mean? That means that the long-term effects of marijuana in the brain, again, multiple studies have been done, show that there's a change in marijuana use and brain anatomy and function. And many of these show evidence that there's a link between marijuana and in particularly cognitive problems, decrease in IQ, decrease in ability to concentrate and pay attention, and therefore affecting overall academic achievement of our adolescents, and overall down the road affecting their long-term health, cognitively and physically. So here's a slide that really talks about the acute negative effects of marijuana overall. And again, as we said, the positive effect, or what you want to call the high from marijuana, the THC receptors, when they attach to the THC chemical, when it attaches to the brain receptors, creates a sense of euphoria, relaxation, and change in pain sensation. So that's what people like. That's what really sort of addicts them. Particularly, we hear so much about the fact that people are smoking weed and using weed because of their chronic pain, whatever that pain may be. And I hear that all the time in my team. Oh, Dr. Swanee, I've got a neck ache, I've got a back ache, I can't sleep. So, you know, I was told by XYZ that marijuana would help me with my pain. So I'm using it, or with my anxiety, or to, like, you know, relax because I'm so stressed out. That's what I hear all the time. That the downside of acute effects of marijuana is that it slows reaction time, it distorts thought and our perceptions, it impairs memory, and then increased use of marijuana, and particularly using marijuana products high in potency of THC, leads to increase in mental health issues such as hallucinations, paranoia, anxiety, psychosis. I want to say I'm definitely seeing much more of this than I did a few years ago. And then there's, you know, a syndrome that we called cannabinoid hyperemesis syndrome. I don't know if anybody's heard of it, but that's really cyclic vomiting. And in adolescents, certainly this syndrome existed in adults who were chronic users of marijuana, but we're now seeing this syndrome of excessive vomiting in adolescents who use not necessarily months and years of marijuana use, but short-term continuous use of marijuana. So acute use of marijuana, but on a daily level, where they're having cumulative effects of THC because they're using it so much. We're seeing these adolescents come in with repeated vomiting to the point they're dehydrated, cyclic vomiting as we call it. And I'll talk a little bit about the fact that we're certainly seeing the syndrome of cannabinoid hyperemesis syndrome in adolescents as well. We've had many, many kids admitted to Hurley Hospital for that, and we're seeing many of them in our ED coming in with this cyclic vomiting syndrome. So here's there was a really good article in PrEP in 2021 which looked at the adverse effects of heavy marijuana use among adolescents and found that 9% of the individuals who used marijuana became dependent on it. And adolescents using marijuana before the age of 18 are 4 to 7 times much more likely to develop what we call cannabis use disorder. This is a DSM-5 psychiatric disorder than adults. And again, symptoms of cannabis use disorders lead to impairment in functioning, increasing intolerance and cravings of increasing amounts of cannabis. Withdrawal symptoms include sleepiness, severe nervousness, anger, tremors, depression, particularly negative mental health impacts. So I'm so sorry, I'm running out of time, but I'm really gonna quickly go through some of these slides. So those of us who take care of adolescents, I think we need to be familiar with the lingo out there when we're talking about substance use among teens. Classically, when I started in adolescence, many moons ago, 30 years ago, most kids were like smoking a joint or smoking a blunt, and a joint is like, marijuana dried leaves and plants rolled up in a cigarette paper, or a blunt is marijuana dried leaves rolled up in cigar paper, tobacco leaves. They smoke it, inhale it, and the effect is within 5 to 10 seconds, and the high lasts for about 30 minutes to a few hours. And again, many years ago, the THC concentration depended on the cannabis plant. The plants are being cultivated that are much stronger in the THC concentration. So again, they're smoking more THC. And the fact that they're smoking this, it has a secondary negative effect on our pulmonary system, same as smoking cigarettes, damages the respiratory system. Smoke is inhaled. We're talking a lot about secondary marijuana smoke inhalation by our children, just as we talk about secondary smoke inhalation by parents smoking cigarettes. We are now having the conversation of secondary marijuana smoke inhalation in our parents who are smoking weed in front of their young kids. Now, as I mentioned, more teens are vaping marijuana. So concentration of marijuana is aerosolized. Again, it's inhaled. So the effect is in 5 to 10 seconds, lasts for 30 seconds. And they are smoking much more concentrated form of liquid THC. So that's again worrisome. Bongs and pipes are another way that they could inhale and smoke the marijuana. And then I really want to talk a little bit about dabbing. I don't know if any of you have heard about it, but what dabbing is that they take this very concentrated form of THC, which is in a wax form, they heat it, and then they inhale it. And again, inhalation, so the effect is right away. But this very concentrated form of THC wax has about 80% THC, and this dabbing is what I'm seeing is leading to severe psychosis, paranoia, anxiety, panic attack, to the point that these kids end up in the ED. So I definitely asked these kids about dabbing. And then, of course, we talked a lot about the fact that we're seeing a lot more edible marijuana products out there, particularly in the dispensaries. So cannabis foods and drinks that are infused with THC. And again, the amount of THC infused in these food and drinks varies. The important thing to understand about edible marijuana products is that you're eating it. So it's got to go through the process of digestion through our GI system. And so it takes a good 20 to 30 minutes up to an hour to feel the true effects of THC, because it's got to go through our GI system. So what happens is that because they're not going to get the immediate high that they're getting from smoking weed, they think it's not working. So they just kind of keep eating more of these gummy marijuana, brownies, cookies, whatever. And before they know it, they've really ingested a large amount of THC, and that could lead to toxicity. Also comes in sprays and tinctures, so all kinds of forms of marijuana. And I just want to point out here that we are seeing case reports of cannabinoid hyperemesis syndrome, which is recurrent cyclic vomiting, nausea, severe abdominal pain. These kids come in with chronic vomiting. We can't find any other causes of their chronic vomiting. So it's really a diagnosis of exclusion, diagnosis based on history. The history is asking the adolescent if they've used marijuana, and then we've got to have a positive urine screen for THC associated with this syndrome to document that they've been chronically using marijuana. And somehow the symptoms are often relieved. This vomiting and abdominal pain and nausea is often relieved with hot showers, and we don't quite understand that, but I've seen kids say that. The parents say, oh yeah, they're vomiting, then they go take a hot shower and the vomiting stops. And the teen says that as well. We don't quite understand how that mechanism works. But we saw several of these teens admitted over Hurley Hospital, and we did a publication in Clinical Pediatrics in 2016 reporting cases of pediatric cannabinoid hyperemesis syndrome. So, I talked a lot about substances, and I'm almost at the end of my talk, and we're running out of time. So I apologize deeply, but I think I want to just touch base on one important point, which is kids are out there using drugs. Good to know that the drug use is declining among our teen, but certainly not gone away. And we need to try and identify kids who are experimenting with substance uses versus going down the road of getting into trouble. So the AAP recommends that we use screening tools specifically for substance use among teens when we're doing our annual visit. Important to note that these screening tools need to be, and these screening questions should be asked confidentially without the parent in the room, because otherwise we're not going to get honest answers. And there's many different screening tools on the AAP website. One is the substance use brief intervention and referral treatment algorithm. And there's really nice educational CME opportunities on the AAP website to go through these CBRIGHT, or many of you might have heard of the CRAFT screening tool, which is what I really like. This is an example of the CRAFT screening interview that I do for substance use. And I start off, again, confidentially without the parent in the room, asking the team and saying, I'm going to ask you a few questions. I ask all my patients these questions, again, trying not to single them out, letting them know that I ask all my teens these questions, and be honest. And a lot of our discussions and answers are confidential. And I'm not going to tell your parents, what you tell me, except if there's something serious going on and I need to inform your parent, then we will certainly do that together, because obviously we sometimes have to break confidentiality for the patient's safety. So then I ask, in the past month, did you drink any alcohol? Did you, beer, I don't even say alcohol, say beer, wine, liquor. Did you smoke any cigarettes? Did you use any e-cigarettes or vape? Did you use any marijuana? And I say use marijuana. I don't even say smoke any marijuana, because kids, again, may say no if I say smoking, because they're not smoking it, but they're eating it. So I may not get the edible component of marijuana use. So now I say, have you used marijuana in any form? Smoked it, edible form. And if they say yes to any of these, then I go down the road to the CRAFT screening tool specifically and ask them, when was the last time you used it? How often? Are you drinking and driving, or drugging and driving, as we call it now? Are you using these substances to relax? Are you using it more and more by yourself? Are you forgetting things as a result of your substance use? Are your family and friends concerned about you? Are your academic grades dropping? Are you failing? Are you going to school? These are all symptoms. And if there's a lot of yes to this CRAFT questionnaire, that kid is down the road of substance abuse. And I need to certainly get the parents involved, and certainly need to get this kid into a substance abuse program. So on that note, I am going to quickly end. This is just an excellent website by the U.S. Department of Health and Human Services, SAMHSA, which is Substance Abuse and Mental Health Services Administration. Excellent educational handouts for patients, for ourselves. I highly recommend going to this resource. NIDA, the National Institute for Drug Abuse, SAMHSA has these wonderful educational handouts you can print, tips for teens that parents can discuss about marijuana, alcohol, tobacco use. And then this was a wonderful poster that was also on the website, marijuana use, drinking and driving. And really, we're seeing posters now, no drugging and driving. And believe it or not, I drive on 75, and now I not alongside the massive, huge posters advertising marijuana dispensaries, I am starting to see signs that say drugging and driving is not okay, meaning smoking weed and driving is not okay. Just like drinking and driving is illegal, drugging and driving is illegal. I'm so happy to see these posters, and the fact that we're educating our adolescents. So I am going to stop and thank you all immensely for giving me this opportunity to talk to you about substance use. I'm happy to take some questions if we have time left, Crystal.
We do. Oh my gosh. Thank you so much, Dr. Soni. That was such a wealth of information, very comprehensive. And I think everyone would agree that it was filled with practical applications as well. So thank you. We actually did get a few questions through the chat box, but they were covered. And the person that asked the question said, never mind, she's covering this. So I think that also alludes to how comprehensive your presentation was. So with that, I will open it up to anybody who has a question that they would like to vocalize at this point. You can unmute yourself. In order to do that, you would have go to the top of your screen in the Zoom, and you'll see 3 little dots. And you can either click that and you'll see the unmute function, or if you go to the participant list, you should see the ability to unmute yourself next to your name as well. So I will wait a few seconds and see if anybody has any questions.
Okay, thank you, Crystal.
Yes.
Is anybody else out there seeing more increase in marijuana use among teens in their practice in the past 1 or 2 years, particularly during the pandemic?
Yeah. Yes, we're seeing more, but I am an adult practice, not pediatrics.
So, and which area is that in?
In Kalamazoo.
Okay. I will share that in the Flint area, I am seeing a tremendous amount of increase in marijuana use, despite what our Monitoring the Future survey is saying. Clearly, the past 2 years, I have seen increase in, and I would say marijuana only, not alcohol, not other drugs, not even vaping as much, but increase in marijuana use among my adolescents and young adults. So, again, quite scary. And as a result of that, I'm seeing kids coming into the emergency room repeatedly with cyclic vomiting because of the cannabinoid hyperemesis syndrome, and also come in with significant increase in mental health disorders because of marijuana use. So one of my important history, and I'm sure, I know all of you also do it, when we are assessing a kid for mental health issues, we definitely have to do a detailed substance use history with them without the parent in the room, confidentially, because some of their increase in anxiety and depressive symptoms may be due to increase in marijuana use. And I'm seeing that. And the conversation I have with those kids is, you've got to stop using it. And those who comply, sometimes, not always, same with the cannabinoid hyperemesis, I say the only cure to your throwing up is you got to stop using weed. And when they do stop it, their symptoms get better in the cannabinoid hyperemesis. Even in the anxiety kids, their anxiety definitely decreases.
In that, with those areas, do you have any tips and tricks to really help them to be willing to try getting off the marijuana? Because I find that they feel anxiety is, they use the marijuana to decrease the anxiety, as well as they don't believe that the hyperemesis is related to the marijuana.
I know, and that's an excellent question. So really the challenge always is to help teens understand that their brain is different than adult brain. So I literally start off with a discussion with the fact that exactly that there is their brain is developing, and how drugs affect their brain is very different than how drugs affect their adults in their life. So whatever they're hearing out there, it doesn't necessarily mean that they as teenagers are going to react the same way as adults do. I also really stress very importantly, that marijuana is a drug, just like alcohol, cigarette smoking, they're all drugs, and they all affect the body different ways, and weed affects their brain. So I focus on the brain. I focus on their young brain, the importance of development and how it affects them negatively. And I, a lot of times, so again, sometimes it's repeated conversation. Sometimes it's, hey, why don't you just like cigarette smoking, cut down, don't smoke it daily, see how you feel. Then I see them back a week or two later. Well, if those who cut back on marijuana use, if they truly did, their symptoms get better. And just that in itself is a positive reinforcement, isn't it? When you physically start feeling better, then we have a conversation again. Well, what do you think why do you think you're feeling better? I'm not smoking, I'm not smoking so much weed. Yeah, how much are you smoking? The last time I smoked was 2 weeks ago. When's the last time you threw up? 2 weeks ago. There you go. I'll help them put the two dots together. So we often have to have repeated visits and repeated conversations with our teens to help them recognize that, one, it's a drug, no matter what, doesn't matter if it's legal. I say alcohol is legal, cigarettes are legal, they're all drugs, they still affect you. So, that frank conversations with our teen is a really important way to help educate them about choices they make.
That's wonderful. And we are getting a few comments, I would say more so than questions in the chat, but I would like to vocalize them for you. Definitely seeing an increase, as everyone has kind of alluded to. but wondering if maybe it's because it's becoming more acceptable to talk about it and share with their providers and their adults in their life. And then another comment about a juvenile recently diagnosed by an ENT with environmental irritant in the throat and tonsils due to excessive vaping, obviously causing, some chronic sore throat and sinus issues. Comments on either of those?
Yes, great comments. The first one in terms of increase in use of marijuana, I agree. And I think also not only increasing comfort about talking about it, but I think us as providers, we're more educated and we're more comfortable asking that questions. I clearly focus a lot more specifically asking about marijuana use in detail than I did 30 years ago even. So I agree with you that part of the fact that the kids are telling us they're using it is because we're asking them the right question now, and we're feeling more comfortable about asking them questions. There's definitely more conversations about weed use, hopefully among teens and their kids, parents and their teens, among teens. So yes, more conversation, more education out there, hopefully, about marijuana use, and just as we have education about alcohol. So I agree with that part. I'm sorry, the second question was what? I forgot. Apologize.
Yeah, no problem. Sorry, I didn't mean to give two to you, but just the comment around, now seeing actual diagnosis by ENTs around that environmental irritant that can happen in the throat and tonsils. Obviously very problematic there.
Yeah. Oh, yes. Yes. With vaping, linked with vaping.
Yes.
Right. Whether you're vaping nicotine or flavorings, as they call it, or marijuana, there's lots of concerns about vaping and the mechanism of vaping and inhalation of these chemicals, what that means, and the negative effect in our whole respiratory tract. For sure, we're seeing a lot more, and I'm sure my ENT colleagues are seeing a lot more of the negative effects of vaping these chemicals because of the cartridge and the e-cigarette mechanism. So that's a whole discussion in itself, but I agree absolutely. I'm sure my ENT colleagues would even say more so they're seeing increased negative effects of vaping on the respiratory tract. Yeah. Aside from the negative chemical effects of whatever it is that they're vaping.
Absolutely.
Mm-hmm.
Well, thank you. Do we have any additional questions or comments we would like to discuss this evening? All right, hearing none, I have to give you another expression of gratitude, Dr. Sawhney. Thank you so much for presenting this evening. Just a wealth of information and incredibly comprehensive. So very much appreciate you sharing your subject matter expertise, and the comments in the chat are echoing that. So thank you.
Thank you.
Yeah. Absolutely. Thank you. And just a reminder to everybody, you should have an email in your inbox with information around the continuing education units that are associated with this program. Please fill out the appropriate documentation, primarily the evaluation. We do need that completed within a 2-week time frame to accommodate our accrediting bodies, including the College of Nursing, Social Work, and CME. So thank you. And with that, I hope everyone enjoys the rest of your evening. I hope you get to spend some time with your families. It was kind of nice to hear the silver lining around how maybe we can correlate increased family time with decreased substance use. So thank you very much, and everyone enjoy your evening. Thank you.
Yes. Goodbye. Thank you all.